Rayden was born February 27th, 2020. The world shut down shortly after. So we didn't see a pediatrician for him until he was 3 months. And for a 3-month-old, he wasn't moving how he was supposed to be moving. So then they set us up with a neurologist to get some further testing, and that's when he got diagnosed with spinal muscular atrophy, type 1.
So Rayden in particular has a diagnosis that makes his body weaker. And because of his weakness, he developed kyphoscoliosis, basically a big long word that means their spine is curved in pretty much every direction. I need to put in certain types of rods that are magnetic lengthening rods, and the middle of those rods are very, very straight. Rayden had all of these curves in his spine, and it was so curved that I couldn't just in one day go in and put those magnetic lengthening rods in. So he needed to have halo traction first so it could gradually stretch out his spine.
My role with halo patients is I go into the OR and actually put on an actual ring onto the patient with the doctors. So we would take a device like this and we would place it on the head and put all of the pins in under anesthesia. The halo system works as kind of its own trapeze set. Traditionally was with weights that would come over with a pulley system on the top and back of a trapeze. Now we use springs to create the tension rather than weights. We are trying to offload the weight of the body, and gravity is just taking a toll on that spine. If a kiddo's kind of over here and we're just kind of like sinking down, it actually pulls you back up so that now we can be more in alignment and not have gravity to weigh us down.
When we were told about the halo traction, I was confused because usually I know I've only seen that in like movies. Just ask all the questions you need to give yourself comfort, because that's what the doctors are there for, to inform you about why the procedure needs to happen and what the positives of it, you know.
Well, it looks really scary. Kids do amazingly well. Once they hear that kids like being in traction, the different functional things they can do that they couldn't do before, that they can breathe better, they can eat better, they usually gain weight in traction, all those things just help reassure them a little bit.
I prepare patients and families with every bit of information we can possibly give. It's a big thing, it's a commitment, but we're here with you every single step of the way.
We packed up everything for our hospital stay. We basically moved our house over here. The first day in the halo was kind of tricky. It was more so trying to get him to understand that we're gonna have this on for a little bit.
I was like, you want to put stickers on it? So now we have stickers on it to make him feel it's not just another thing on him. He'll tell you, no, I have a halo. Like, it's not the hat, it's not this. Yeah, it's my halo. Surprisingly, he sleeps really well with it. He's an adaptable kid for sure. The people that cook since the day one that when we got his diagnosis, like, they've been on top of it. You know, the people taking care of him care about him just as much as we do. To see him still get in the child development of social life, it's gonna be hard to get him out of here, honestly.
So the fun part and the best part is when I get to show them the before and after, and they get to see all the hard work that they put in and how it's benefited their child.
It was amazing when we first saw the difference in the x-rays, because I remember the first set of x-rays he got, it was like, oh my gosh, when did it get so bad? So seeing that and then doing the halo and seeing how much he has improved has been amazing. You can already see things that he's doing more by himself.
When you get to come together with a family, it's just such a magical moment to be able to really be there for the family and all be part of the same team.